For those patients who have early stage breast cancer that's hormone receptor positive and their surgery is delayed, and now they know that they need to start anti-estrogen therapy or hormonal therapy during the time that they're waiting for their surgery to get on the schedule, what type of doctor is going to be the one that they need to see to get on that medicine, the anti-estrogen therapy? Usually it's a medical oncologist. Should the patient, make an appointment with a medical oncologist to start that treatment, or can the surgeon start that treatment? What's the best way to get that treatment going?
Every institution will approach the anti-estrogen therapy in a specific way. We do multidisciplinary tumor board every week where we are NAPBC accredited. So the medical oncologist, radiation oncologist, and surgeon all look at all the information with breast imaging and pathology. We also use a lot of genomics, and genomics is a term that a lot of people get confused with genetics. Genomics is your tumor's DNA. So it could be a mammoprint, an oncotype, an endopredict, a test where we actually take the tumor's DNA and do an assessment to determine kind of the best systemic treatment to help that person. So in our particular case, I am not having my patients see the medical oncologist in person. They're going to do a Zoom appointment because my medical oncologist is where patients are going in to get chemotherapy. So we're trying to decrease the number of people going through that department. So a lot of the anti-estrogen therapies, we decide at tumor board what's best. We look at the patient's bone density. We look at their past history. We look at their menopausal status, come up with a recommendation. And many times I will start the patient on the anti-estrogen therapy, and they will then do a Zoom or a telemedicine appointment with medical oncology so that the patient knows that everybody's on the same page.
Which patients are you seeing through telemedicine, and specifically saying, let me see you that way instead of having you come into the office?
So telemedicine is being used across the board in multiple institutions in many ways. Personally, right now, my best use of telemedicine is for patients that have been diagnosed over the last, 3 to 4 weeks, where we were in the process of getting MRIs and genetic testing and genomic testing. And we're calling these COVID plan of care appointments, where we want to make sure that that patient knows every result. We want them to know what that we follow the NCCN guidelines for their care, that we have come up with a comprehensive process with medical oncology, radiation oncology, and surgery, so that they have an absolute understanding of what to expect. We're not making their follow-up appointments in the office unless we have an appointment to assess their response to neoadjuvant chemotherapy or chemotherapy given to shrink the tumor. For patients that have small, early stage cancers, I am not going to bring them back in for a repeat ultrasound in 6 to 8 weeks because they've got a low risk tumor, it's small, and for a lot of this population, they're over the age of 70, and I really don't want them leaving their house to come in. But we are doing these plan of care appointments now, and then we've made it so that our nurse navigators will be calling these patients every other week just to check in, because we're finding the level of anxiety, just hearing a comforting voice, knowing that someone, you can see their face, and you can tell a lot by looking at someone, whether or not you can see fear in their eyes. And our biggest thing right now with the telemedicine is to alleviate the fear, to let the patients know that there's a plan of care, that we've got this and we've got them, and give them the opportunity to ask any questions or tell us whatever they need to know. And so far, it's been wonderful. I mean, I've been doing post-op appointments. Today, I did a post-op appointment for a bilateral nipple-sparing mastectomy, and I can check the incisions. It's completely, it's completely confidential on our setup, and it allowed that patient not to drive an hour and a half and not to come out in public.
I've also found that patients who are having a telemedicine appointment seem to be a lot more relaxed because they're in their own home.
Yeah.
Compared to the way they feel when they're in our world in the hospital. So maybe after all this COVID stuff hopefully blows over sooner than later, we might integrate telemedicine more often for all the reasons that you specify, just the ability to connect with people regularly, to let them know that you are on top of things, that you care, to answer any questions, to revise the plan, to update them all along the way. So that's really very helpful.